Okay, so today we're going to study another story in pathology about cell death. So this is also one of the very important short notes that is asked in your exam. Remember, whenever you're attempting a short note in your exam, make sure that you draw a table and write it properly. So today's story is about how to remember the difference between a programmed cell death, that is called as apoptosis, versus a non-programmed cell death, that is necrosis. In your exam, remember, whenever you're attempting a short note in your exam, make sure. Okay. So always remember, apoptosis is like a cell suicide. So whenever cell decides that I have to kill myself, okay. So what should happen? What will happen? So remember, you should never do suicide. Cell should never do suicide. But this is, suppose if cell decides that I have to kill myself, what should be the things that cell will do? So the cell, why does he do suicide? Because he's very sad, he's very depressed. So because he's very sad, he's not eating the food. So because he's not eating the food, his size becomes smaller. So size becomes smaller. Now, why does he become sad? Because uska dil toot jata hai. Okay, so because his heart is broken, he's very sad. Okay, so the nucleus undergoes fragmentation. Okay, so the nucleus undergoes fragmentation. So the chromatin is condensed and the nuclear undergoes fragmentation. Okay, so that is very typical. So condensation of the chromatin occurs. Okay, condensation of the chromatin occurs, and the condensation occurs and it can further fragment. Then what happens? Obviously, when the cell wants to kill itself by suicide, it will say, I will never damage my membranes. So membranes will never get damaged. Obviously, the cell wants to die in the most painless manner. Okay. So there'll be no damage to the cell membranes. Obviously, when there are no damage to the cell membranes and the cell is becoming smaller, he's depressed. Obviously, nobody comes to know that he's going to do suicide. So it's a very secretive thing. So that is why nobody, who is people, inflammation. So here we have no inflammation because nobody should come to know that the cell is going to do suicide. So nobody will come to know. So no inflammation. And this is a very silent process. So most of the physiological cell deaths or physiological cell deaths like in embryogenesis occurs because of apoptosis. Also, it can be pathological also. Like suppose if the virus enters into the cell says, okay, let me kill myself so that the virus is also killed along with me. So here also cell is undergoing apoptosis. So it can be either pathological or physiological. Remember, but it takes a lot of energy to do suicide. Okay, so you require very lot of energy to plan, okay, to program that today I'm going to do suicide. So what is this? It's a very energy dependent process. It requires a lot of energy and it is programmed. Now, in contrast to this, look at the opposite side, necrosis. Necrosis is like murder. When somebody is coming to murder you, you also don't even know today that today I'm going to get murdered. Even I don't know that today, okay, that I'll get murdered. So it's a very passive process. Nobody knows about it. It happens suddenly. And anybody who's coming to murder you definitely will damage your membranes, okay, because he wants to kill you. So he'll always cut your membranes. So membranes will always be damaged, okay. And when membranes get damaged, you scream. So when you scream, your size becomes larger. Your size becomes larger. Cell becomes bigger. And obviously, so what happens here? The nuclear changes occur in 3 steps. Initially, the nucleus becomes smaller. Okay, so that means, okay, so the nucleus will become smaller. That is called pycnosis. Okay. Later on, what will happen is the nucleus will get disintegrated. Okay, it will be broken. That is, karyo means nucleus, rhexis means fragmentation. So this is called karyorhexis, followed by third stage where the nucleus completely dissolutes. So this is called karyo. Karyo means nucleus, and lysis. Okay, so these are the 3 stages in which the nucleus changes in necrosis. Obviously, so you live in a country called India where there are 2 kind of people who are there. Okay, so when somebody is murdering you, there'll be a lot of people who will be coming there. Okay, so most of the time, the people who are there will be standing far off. They'll be just making your videos. So who are these people? They are the inflammatory cells. So there will be lot and lot of inflammation. There'll be lot and lot of inflammation. So there'll be a lot of inflammation, but there'll be very few people who will come close to you to help you. So what will happen? So the murderer will come and he's trying to kill you, but he'll also kill the surrounding cells who are coming to help you. So in necrosis, usually a contiguous group of cells are affected. Contiguous group of cells are affected. So this is in contrast to apoptosis, which was a suicide, which was done by just one cell. Okay. So today, if somebody decides to do suicide, he will only do suicide. He will not call his friends and say, hello, everyone, come today, we all will do suicide. He doesn't do it like that, okay? So it's always a single cell who plans to do suicide. So it's always single cell who plans to do suicide. Whereas in necrosis, usually group of cells undergo necrosis, okay? Now, obviously, so who are these contiguous group of cells who come closer to help? And who are the inflammatory cells who are standing far off and they're making the videos, okay? So they are inflammatory cells. So inflammation is always a feature of necrosis. Now, always remember, usually necrosis is pathological, okay? It's not physiological. If somebody is trying to murder you, there's something pathological about it, okay? So it's always pathological. And it does not require any energy. It's a very, very passive process. It's non-programmed process because today you also do not know that you're going to do somebody's going to come and kill you. Okay, so that is the point that you have to be clear. And this is a table that you should draw in difference between apoptosis and necrosis. So this is a table which will help you get good marks. Always start with size, the nucleus, the membranes, the cell, single cell or multiple cells, inflammation, pathological or physiological, and energy dependent. So that is the classical example. So you can write the examples also here, which we have just now told about. Okay. So like embryogenesis, somebody says embryogenesis is a type of apoptosis. Whereas when we say about necrosis, okay, necrosis can be seen in any infective conditions. Okay, so infections basically causes necrosis. Okay, so infections causes necrosis. So this is some changes which everybody should be clear about in difference between apoptosis and necrosis. Okay, so that's a short note which comes in exam. Everybody should write these points and then you will get full marks. Bye. If there are any doubts, you can ask now or we'll end the session. Okay, so if there are no doubts, bye-bye everyone.